Health Check is presented by Island Cancer Center.
On Sunday, the Guam Medical Society hosted the 8th Micronesian Medical Symposium at the Westin Resort Guam in Tumon. This year's theme was Elect a Healthy Heart, recognizing that heart disease is the leading cause of death in our island. Local and off-island experts in health promotion, diabetes and hypertension control, and interventional cardiology provided technical updates and professional perspectives on preventing heart disease, controlling its risk factors, and diagnosing and managing common cardiovascular conditions that afflict our island community. Demira Hale is certified in adult and child and adolescent weight management, renal nutrition, and lactation education, and spoke on practicing what we preach, a heart-healthy diet approach.
You mentioned about ketogenic diet. Question about maybe about eating earlier and not eating during like night hours. Would you see that as part of the ketogenic diet, like maybe like eating 4, 5, 6 hours before going to bed? Would you see that as more beneficial than trying to, like you talk about eat like a pauper?
Eating more for the beginning part of your day, less towards the end.
In terms of weight control, that's very helpful to eat more towards the beginning part of the day when you're actually burning those calories. So when you think you're going to just go straight to bed and be very sedentary, you don't need fuel for that.
Heart disease causes 1 out of every 3 deaths on Guam. It contributes a significant proportion of the chronic disease that burdens our island. Yet heart disease can be prevented or controlled through healthier lifestyles and eating habits, early detection, and clinical intervention through evidence-informed medical care.
Parents, you are the kings and queens of your home, and Dr. Collingle reminds us you are in charge. Yes, you're retired when we go home, but you are still in control. So you help determine and shape and be the role models for your children. At Public Health, we have salt reduction initiatives. So if you go to a restaurant and there's no salt shaker on the table, it's because Public Health agreed with the restaurants to remove the salt. Because many of us add the salt to our food automatically without tasting it. And the chefs who create the food season it just perfectly. So we have many restaurants and hotels who agreed to take out the salt shakers. We also have healthy food labeling and healthy food options as a result of this, together working with the GRMC and the folks in the community. So just a reminder, folks, if you could see the salt on your food, it's too much salt.
The day-long symposium was a success and would not have been possible without the assistance and support of various sponsors, partners, and volunteers under the leadership of the Guam Medical Society. With this week's Health Check Report, I'm Jonah Gancharfis.
Health Check is presented by Island Cancer Center.